Good morning. We'll give it maybe one more minute. 9:33 is our typical start here on the 9:30 call. Yes, good morning, Harold. It is very fall today here in Massachusetts. Uh, and Jeff, I'm sure you have slides, but before you do, is what I gotta say. Socks in two. Last night was very exciting, so we got to keep hope alive. Speaking of October and fall, that's my prediction for tonight. I don't know if Clarence is on, our resident Yankee fan, but bases loaded, bottom of the ninth, two outs. We had him just where we wanted them. Um, all right, well, it's my pleasure to introduce Jeff Liebman. Welcome back to the 9:30 call. You were here in the fall, last fall. Wow, was it last October that you were here? And we're so excited to hear the update. So as you are starting your presentation, if you could just first tell us a little bit about you and how you came to be into your current role, and then we're looking forward to the update.
Great, thank you. And just remind me on the format, do you want me to take 20 minutes and leave 10 minutes for questions or
Yeah,
questions
so
only?
I'll also be monitoring the chat, so you don't have to worry about that. And then I will also send it to you. But if
Okay.
you, so I'll interject questions. So yeah, plan
Sounds,
20,
sounds,
25 minutes. Great.
sounds great. So I'm a professor of public policy at the Harvard Kennedy School and an economist by training. And the way I ended up involved in early education research is about 3.5 years ago. Amy Kershaw, who's the commissioner of early education in Massachusetts, and I were talking, and sort of appropriately, the reason we know each other is our kids were in preschool together 22.5 years ago, and that's where we got to know each other. But Massachusetts has been making quite a lot of additional investment in the early education space. And Amy was describing the challenge in thinking about how you incrementally improve the system if you don't know where you're heading in the long run. And from that conversation, I decided it was this was an area where things I'd worked on in the past, like the Affordable Care Act, gave me insights that could possibly be helpful to this debate. And also, because of the federal dollars that had flowed in during COVID that caused the state to have financial relationships with many more providers than they historically had. It meant that the data available to figure out what's going on in the system had gotten a lot better, and so there was interesting data to be analyzed. And for all those reasons, I got involved in this project. And so I wrote something that I talked about a year ago about analyzing the childcare market in Massachusetts. But there was a big gap in that initial work, which is as you sort of think about where we are and where we're headed, we actually need to know what parents want. And should we be trying to, today about 54% of Massachusetts uh, children who are between 0 and 4 are informal early education and care. Should we be aiming for 60%, 70%, 99%? What should we be aiming for? And without knowing what parental preferences were, it's hard to know where the system should be headed. And so what I want to mostly do today is talk about a survey I fielded of 1,000 Massachusetts mothers with children between 0 and 4 to ask them basically if they could if there wasn't an affordability issue, and specifically what I ask is if childcare and early education were free, how much would you use? And that gives us a sort of target for what we might be trying to aim for in terms of the capacity of the system. So that's the background. So let me share slides now. Let's see if we can get this to.
This is the hardest part of the call for everybody. I do see that Clarence did rebut in the chat that he's calling for the Yanks in three, which I guess is your only rebuttal since you lost game one there, Clarence.
See what Zoom does when I go to slideshow here. All right. Um, is that reasonably visible?
It is, it's showing kind of two slides at the same time.
Fine. There's got to be a trick to get Zoom.
There,
Uh,
if you do a slideshow,
Let me see this here.
there, yep, and then yeah, there you go. And just do from the beginning.
I'm just going to go back to this again. There's got to be some trick to.
You got it.
It's working for you now?
Yep, you did it.
You got a full screen and nothing
We
else?
got a
All right.
full screen. Don't touch anything else. We're good.
All right, good. All right. So first of all, I just have some acknowledgments, which is I'm grateful for funding from the Commonwealth Children's Fund and also the Rappaport Institute for Greater Boston. And I'm not sure what percent of this audience is from outside Massachusetts, but for people who are, I just want to emphasize that Massachusetts really has made some tremendous progress in recent years. In my paper last year, I tallied all the different funding flows and showed that we're spending 58% more in inflation adjusted dollars than we were 5 years ago. And you can see the percent enrolled in formal care has come up a few percentage points. The wages for teachers has come up a bit. And the number of subsidies for low-income families has been going up. So this is all in the context of a state that's already making progress, trying to think about how it can make even more progress. Although I should note that some of the funding in the last year has been level funded in a way that the legislature thinks means we're doing fine. But in fact, if you level fund when inflation exists and raises have to happen, you're actually going backwards. And so there's some parts of this where the story is a little bit where we can't keep level funding things without starting to be going backwards. Okay, um, so I basically want to talk about the remaining gaps in capacity, quality, and affordability, and my survey is going to mostly inform the capacity part of this. Um, the methodology is I contracted with Mass Inc. to administer a survey of the 1,000 mothers. The survey was mostly done through a web panel. Basically, there are three ways you can do surveys these days. You can call people on the phone, you can text them and ask them to click on a link, or you maintain these web panels of people who agree to take surveys on a regular basis. And as you probably all know, if you try to call people on the phone, you get rid of, almost no one will take surveys today. Same with text links. So almost all of my sample comes from this web panel. And what's nice is that people get invited to take the survey, but they're not told what the survey is about. And so there's no selection bias in terms of like people choosing to take the survey because they really want to complain about their early education system or they're really happy about it. They just say, here's the next survey. They click on it and then they find out what it's about. And of the people who got invited, 85% of them completed it. So the sort of effective take-up rate is quite high. All right. Last thing I'll say is that the survey, even unweighted, was very representative of demographics of people in Massachusetts. I do weight it, and I'm still playing with the weights. So I'm going to actually release the study in about 2 weeks, and there's some numbers that are like 80% that might turn out to be 79% in the published version. Don't go tweeting these results quite yet.
We appreciate the sneak peek.
Yes, exactly. Okay, so just sort of as background, here's when I asked families what is their current primary child care arrangement. If you look at the rightmost column, 27% were only using parental care. The next three rows show types of formal care. 35% were using child care centers. 8.4% were using licensed family care and 9.3% were using school-based care. And then you can see the informal types of care. About 5% were using nannies, about 3% were using some other kind of paid informal care, and about 10% were using friends and families without payment going on. Um, okay. Uh, the typical hours, looking at the bottom right here, of the people who were using uh, paid childcare in the sample was 27 and a half hours. That'll be interesting when I show you how much more they want. And you can see the full distribution and how it varies by age, but that's probably not the right thing to do on this call. You can study the paper later if you want to look at all those numbers. And just as background, I asked people, how do you pay for care? And they can choose more than one of these options, but 84.5 said they're using current income, 24% say they're using up savings, about 10% say they're taking on debt. About a
Wow.
third say a family member helps them pay. About a quarter actually said that an employer helps them pay, which was higher than I expected. But that was also there. Okay, and then I asked the question of if childcare were free, would you use more hours of childcare for this child for the folks who are already using paid childcare? And of the people already using paid childcare, 72% would use more hours if childcare were free. And when asked how many hours more would they use, the median was 10 and the mean was 16 and a half. So, these are folks who are using 25 or so hours who want to be using 35 to 40 hours a week if they could afford it. And then for the folks who are not using paid childcare, and this is again the population where you wonder whether they actually want it or not. It might be that they don't actually want to be using formal childcare, but it turns out that 80% of the folks not currently using paid childcare would use it if it were free. And I think this is important if you sort of step back and think about why it is that society has not solve this problem already. I think one of the things that prevents the policy world from fully from feeling like it's its obligation to take care of 0 to 4 year olds is the sense that parents just want so many different things. There's so much heterogeneity in preferences. But in fact, it seems to me, from at least in this Massachusetts sample, um, people basically want the same thing. They want affordable formal childcare. The overwhelming majority of people want that. And you can see the ones who are not using childcare now who say they want a substantial number of hours. The mean was 26, the median was 25. So they're not just asking for 5 or 10 hours a week, to get a break from parenting. They really do want a substantial amount of formal childcare. Um, so this is a matrix that shows what people are currently using versus what they would like to be using. So if you go down the right column, you see what they're currently using: 30% parent only, 32% center, 8.5% formal family care, etc. And if you do the bottom row, you see what they want. So whereas today 30% are currently doing parental care only. Only about 6% want parental care only if it were free. 53% want center-based care. 18% would be using family licensed care. 18% would be using school-based care. So you have a big shift into formal care if people got what they say they want. Okay, and then I have a bunch of questions that, well, actually, so that I think there's an interesting question about whether the first year of life is different than the other years. And so I asked a series of questions about for their youngest child, were they working during the year before the youngest child was born? And about 80% were. And then did you go to work at some point after your youngest child was born? And about 80% of those said yes. So that's 80% of the 80%. So 64% of the whole sample. And then the question was, how long did you take off from work after your youngest child was born? And the median answer to that was 17 weeks, and the mean was 24 weeks. And then I asked, if money were not an issue, how long would you have ideally liked to have stayed home with the child before returning to work? And the median is 52 weeks, and the mean is 78 weeks. 80% wanted at least 6 months of time off after their child was born. And the median difference between what people desired and what they took was also about 6 months. So if they took 2 months, they wanted 8 months, sort of like that. So there's uh, um, if you start thinking about the first year of life, I think there's a interesting question about whether the right thing to be doing is to be providing a lot more formal care or to be making it financially possible for people to, in combination with our existing leave policies, to extend those leaves further. Um, all right, just another couple questions that I tacked on just because I sort of uh, was curious. Um, Please let me know whether you strongly agree, somewhat agree, neither agree or disagree, somewhat disagree or strongly disagree with the statement. Given how much of my salary goes to childcare, it is barely worth working. And you can see over half either strongly agree or somewhat agree. In fact, over 60% are in one of those two categories. Do you pay more each month for childcare for all of your children or for your rent or mortgage? 45% are paying more for childcare. Um, what percentage of income do you think it's fair to expect parents to pay for their kids' childcare? The median answer is 15%, which I find interesting given that, I think the policy debate, maybe 5 years ago was sort of focusing on let's figure out how to make sure people aren't paying more than 10 to 15%, whereas there's a focus on 7%, these days. These families at least sort of there's a widespread, but 15% is the most common, is the median response to how much it's fair to expect people to pay. Um, okay, so putting it all together, I want to describe what I think are the three early education gaps in Massachusetts, meaning the capacity gap, um, the quality gap, and the um, affordability gap. And then I'll explain what I think the policy steps we should be taking are to address these gaps. So what this shows is that 54% of children are enrolled in formal childcare today. Based on the responses to my survey, 89% of parents would use formal care for their children if they could afford it. And so there's this gap of about 35% in slots relative to what's currently being offered. Um, but the slot gap doesn't fully measure the full gap because some of the people who currently have care want more hours. And so we're basically delivering about half the hours that people would like to be using if they could afford care in terms of again formal childcare. Um, in terms of quality, and I'll come back in a minute to why I think one needs to start with quality before one actually adds slots. But I think of quality as primarily being driven by the workforce, and to make it plausible for people to make careers out of early education and to have the incentive to invest in their professional development, one needs to pay them adequately. And you can think about different targets for how much you want to pay folks, but it seems to me that the minimum target for the wage level in this sector should be that a lead teacher makes as much if they work for the whole 12 months as a beginning kindergarten teacher gets if they work 10 months. Okay, so the same annual salary as a kindergarten teacher, even though a kindergarten teacher works 10 months and an early educator takes 12 months. If you take that as your measure of parity, we're about $6 an hour short of that in Massachusetts. You could have obviously have a hourly wage parity. That would be a more aggressive goal, but it seems to me the minimum goal if we want to be able to have people that have this be a career is to go up from what is basically something like $46,000 a year to something that's just under $60,000 a year as annual pay. And then on the affordability side, I think the minimal step, the first step the state needs to be taking is to have enough subsidies available for everyone under 50% of the state median income, which would basically require doubling the number of subsidies that we're offering right now. Um, the the so what can we accomplish in a reasonable amount of time? So um, I don't think there's any way to go all the way from 54 to 89%, in a few years. It's actually hard to add capacity, and you sort of need to do that in a deliberate way. But I think over the next 5 years, we certainly should be able to get from 54% of children in formal care to 65%, meaning adding about 7,500 slots a year. And we should do that while improving quality and affordability. And in the paper I wrote last year, and I still believe this very strongly, I think you have to start with quality because there's very clear research both from Canada and from Tennessee that if you just expand slots without worrying about the quality of those slots, you can actually have adverse child outcomes. And so I think you have to start by dealing with the quality side, which is uh, and the thing that gets that going is raising early educator wages. And that protects you against hurting children by just adding slots that aren't of sufficient quality. But in addition, there are a lot of centers that aren't using their license capacity because they can't recruit um, early educators, and raising the wages helps with that. And so, if if uh, if uh, if I were in charge of things, I would say the first thing the state should be doing is raising early educator wages by $6 an hour. Have the state fully pay for that increase in pay, probably through the existing C3 program. And that you have to do that before you start adding slots because you want to make sure you're actually doing good for children when you're putting them in formal care. You also need to do some subsidizing of startup costs of renovating space, of I would argue you should subsidize some of the uh, enrollment risk in the first couple of years that a center brings on new capacity, just in case they can't fill all the slots immediately. And then once you've brought in the new capacity, then you start adding the new subsidies because it doesn't do a lot of good to give people subsidies that they can't use because they can't find a slot. And so you need to time the phasing in of the subsidies with the timing of when the new capacity is coming on board. And what I calculate in the paper that I'm going to release in a couple weeks is that this doing these three steps would cost an average of about 1.1 billion per year. It phases in, so it's about 800 million in the first year, rising to about 1.5 billion in year five. But I think we'd get about 20% of that back from increased tax revenue as parents, primarily mothers, increase their labor supply, and from reduced transfer payments again as earnings increase. And so I think the net cost over the next 5 years to the state of a plan like this would be on the order of 900 million per year. Okay, so I think that's what I wanted to say.
Thanks so
I'm
much,
happy to open
Jeff.
this up to discussion.
And just so folks know, we're recording the call, but we are going to delay posting the recording so that we are in line with Jeff's release of the paper. So I also added in the chat hit the paper that was released last October. You can read that one first and get ready for this release. There are some questions about cross-state representative representation or geographic kind of in the data in the mom and the folks that were surveyed.
Meaning,
So
is
what
Massachusetts representative of the rest of the country?
Yes. Or
Yeah.
no, in Matt for the survey were people representative of across Massachusetts.
Yes, yes. It was
It was.
representative of all counties, and I can
Great.
see.
Brian Gold said it's interesting about the median and mean regarding taking off work given the lengths for paid family medical leave. Amaris says, thanks for this. There are lots of centers that have preschool age children, preschool programs. How is this question asked to distinguish between childcare and preschool? A perennial question, or was it?
Sorry,
So, like,
yeah.
some people call it preschool, some people call it childcare. Was there any distinction in the way that you asked the question to know?
Yeah, let me see if I can find the exact question. I mean, I gave them a list of options to choose from. And so, like, who regularly cared for your child? And so then it was child care
So they picked
center,
what they,
family-based
right.
center, school-based. And so, I should pull up this. Well, we'll keep asking. I'll pull up
Yeah, I
the
will.
survey and give you the actual
Lucas
data.
says, I find it really interesting, alarming that the issue of debt and raising children, what you captured shows currently using debt, but doesn't it perhaps capture those who have previously been in debt or are in risk of going into debt? So that the people that said it is one thing, but there's probably other people. It's probably bigger, right?
So you're saying that, at a given point in time, maybe they are using down their savings, but if we surveyed them when their child was 5 rather than 3, they may have
Right.
moved up and gone and hit the next stage. That's certainly uh, possible.
And
I guess
then
I could look at the parents of the older ends of this and see if it's any higher for like the
Right. If
Parents
it's
who have
like
multiple children or who
when
have
you're
five. That's
Brian
interesting.
Gold said, I wonder about this debt trajectory mirrors or doesn't related to higher ed or other education debt accrual. Is the percentage the same or different? So to look at that.
Interesting.
Kira says, great point about subsidizing startup costs for new program sites. This doesn't really exist. And Donna Danette shares in fact, there are barriers needing to prove a financial foundation before even being enrolled children. Hello, Sarah Savage from the Federal Reserve Bank of Boston. The question of whether parent would use care if free is great. A challenge was that it could depend on when the care is available. Was amount of care specified in the questions full day care year round, let alone non-traditional hours?
So the no, the the way I asked it was simply, would you use paid care if it were free, and then what kind of care would you use? So I, you know, totally get the point that people's responses may depend on the context, but
Right, in their own context.
it's a good
Lucas
point.
shared this is perhaps a little bit of a chicken and the egg, but programs are largely funded by attendance. Increased access would directly connect to an ability to increase wages. Natalia said she has a lot of, she kind of restates a lot of what's happening. More than half infant care still occurs in informal settings. Given the structural barriers to universal free childcare, how might policy and innovation begin to formalize support domestic-based solutions such as nanny shares or neighborhood pods that not only address the affordability and supply gaps, but also provide the trusted, emotionally secure environments infants need for that first critical 18 months of life?
Yeah, I mean, I could certainly imagine a system where we say, um, you have a choice in the first year of life. Between a $15,000 cash money to let you stay home or pay informal care or something versus
Yep.
a spot in the center. And that given that kind of choice would actually save money because infant care is so expensive, letting people who would rather use something else or stay home do it would both reflect preferences and could save money to the system overall.
Um, and please line through to callers, add some love and appreciation for this work in the chat, which people are already doing. Don Holly wonders, how do these recommendations proceed to take action? What is next?
Well, that's a good question. You know, I think one plays both an outside game and an inside game. One tries to get the governor's office and the legislators to understand these results and understand that there's one can actually uh, move systematically toward what parents want, and then you also have to make sure people on the outside are letting the people who make decisions understand that they really want this.
Right. Andrea, I saw that you had your hand up. I don't know if you're still here, if you wanted to ask your question. She may have had to pop off. Um, And then have you noticed a geographical difference? So if you can sort the data by geographics, were there geographical differences?
I haven't focused on that within the state, but I definitely have the ability to do that. I mean, we have people in all counties in the exact proportion that people do live in those counties, and so I could break that down that way. I've basically so far in the paper, it's all by age, and so I'm focusing on differences by age
By age.
primarily, but I should look at the county. That's a great suggestion.
Great. Well, so we are so grateful that you came here and gave us a sneak peek of this work. We look forward to you releasing the paper. So when you do that, we will share it with our with the folks along with this recording. And just really want to appreciate all the work that you put into this, all the thinking that you've done around this, and the messages that you are sending us as advocates, as well as thinking about policymakers. And Melora also said, it feels like Professor Liebman has handed us the football off to all of us. Let this not be a tree that falls in the forest. And Brian Gold says another metaphors. We should have some sort of baseball metaphor too. Um, but thank you so much for joining us, and please come back anytime. And we're always excited to hear the work that you're doing.
Appreciate it. Thank you for listening.
We'll send you this chat too. And when everything comes out, if we could have your slides, we'll link to the report so that folks will have this as a resource.
Perfect. Thank you.
All right, have tomorrow. I'm so confused about what day of the week it is. Today is Wednesday. game two of Sox and Yankees. Tomorrow on the 9:30 call, let me see. This is not good. I started talking and I didn't look. Tonight we have the 9:30 call in Espanol where Paula is coming back from the city of Boston. And then tomorrow we're going to hear from Donna Volpita, who is the co-founder of Pathways to Empower. So we will see you tonight at the 9:30 call in Espanol or tomorrow in the morning. Have a great day. Thanks so much for joining us.